All righty. So we are going to go ahead and get started. Hello, everyone. My name is Cha Cha Miller, and I am a registered dietitian specializing in maternal and pediatric care. I am also the Chief Clinical Officer for Mother of Fact. And Mother of Fact is a telehealth platform for nutrition care from registered dietitians for women from pre-pregnancy fertility issues throughout pregnancy and beyond. We specialize in high-risk nutrition intervention and care, and we work primarily with birthing people from resource-restricted communities. If you have any questions or curiosities about Mother of Fact, kind of who we are and what we do, I will drop my email address in the chat, so you can feel free to message me following the webinar. So before we kind of get into it, let's do just a little bit of housekeeping. Please keep your microphones on mute and save any questions for the end of the presentation. You are also welcome to drop your questions into the chat, and we will get to as many as we can at the end. So that said, welcome to our first webinar. So this webinar is the first in a series, so please stay tuned for announcements regarding our next webinars, which will cover topics like maintaining energy during pregnancy, eating for energy during pregnancy, gestational diabetes, prevention and management, and what to eat in the third trimester to support birth and postpartum recovery. So our topic for today is managing nausea and food aversions in the first trimester. And before we jump in, I just want to introduce our presenter and one of the dietitians on our team, Destiny Nolan. Destiny is a registered dietitian based in Atlanta, Georgia, where she lives with her husband and her eight-month-old baby, who is the absolute cutest. She began her nutrition counseling journey helping women with hormone imbalances and fertility. And when she soon realized this led to, she realized that this led to patients needing support in pregnancy as well. So that's kind of what led her to Mother of Fact about 2 years ago. Destiny loves helping women through their pregnancies with food, with nutrition, as well as just kind of being another piece of their overall support system. Destiny is absolutely amazing. I'm a little bit biased, but I love her. So I will now turn things over to you, Destiny.
Thank you so much, Cha Cha, and thank you for all the compliments. It's so sweet. Like Cha Cha said, I am a dietitian here at Mother of Fact, and I love it so much. But we're going to be talking about nausea and food aversions, and this is a topic that's a little near and dear to my heart. Like she said, I have an 8-month-old, and I struggled with nausea and food aversions so bad in my pregnancy. So it's just a topic that I feel like I can speak well to, and it has definitely the experience definitely lent me a lot of opened my eyes to what some of my patients were experiencing. So we will go ahead and get started. Like Cha Cha said, if you have any questions, please throw them in the chat. If you have comments, anything like that, and we will get to those at the end. Oops. Okay. So today we're going to be talking about understanding first trimester nausea. Then we'll go into symptom management for that nausea, and then go a little bit into nutrition specifically and how that relates to a healthy weight during pregnancy. And then some recommendations for moving forward in your pregnancy if this is something you're experiencing. So understanding our first trimester nausea. So if you're experiencing it, you know what nausea is, and it's not a fun time. Um, some of us are calling it morning sickness, but for most people, it's lasting all day long. I know for me, it was 24/7 sickness. So it can happen any time of the day. Most people, it is worse in the morning. That could be related a little bit to hormones or the blood sugar changes that happen overnight when you're sleeping. But you're going to have a little bit of discomfort, uneasiness, wanting to potentially have some vomiting. Some people have vomiting with their nausea, some people don't. It just depends on the person. But that can go hand in hand with food aversions, where certain foods just feel or sound absolutely awful to you, and they can give you nausea, or the nausea can give you the food aversions. They kind of just work on each other there. So it is one of the most common symptoms in pregnancy, and in severe cases, we call that hyperemesis gravidarum. Your doctor would definitely give you some potential further recommendations if you have a case that's that severe. And if you do get diagnosed with that and you're working with one of us, please let us know so that way we can help you as much as possible. But some people say it could be a sign of a healthy pregnancy. I have seen people that don't have nausea and be completely healthy in their pregnancy too. So who knows? Um, with that, like I said, it can lead into some food aversions. So, like I said, some of those foods just sounding just completely awful to you. They might trigger the nausea, or the nausea might trigger the food aversions. A lot of common ones that I experienced and I've seen my patients experience include like meats and proteins is one of the biggest ones. Very fragrant foods. So even just the cooking of certain foods, I've heard friends say like the smell of coffee triggers them a lot. Cooked vegetables is sometimes hard for people because they're like mushy or the texture, that kind of thing. And eggs is a really big one as well. And I'm sorry if you have aversions to those right now and I'm talking about them. I apologize. But the aversions could come by either the smell of the food, the sight of the food, even just people talking about it. You can even have aversions to things that aren't food, like the grocery store. That was a big one for me. The refrigerator, brushing your teeth, which is a really hard one. That one was really big for me as well. So avoiding those foods is usually what people opt for. So that's why we talk about what you can do to optimize nutrition, because if you're missing critical nutrients or key groups of food because of those aversions, we want to make sure that we're still getting a variety of those nutrients, which is where dietitians can be super helpful. So what causes the first trimester nausea? And I will note, and I think it's noted somewhere else in here, you might be beyond your first trimester and still having some nausea. All of this is still applicable for you, but some of it could be related to the hormones that are rising throughout pregnancy. You do go through a huge hormonal shift when you get pregnant, in early pregnancy, especially as that progesterone is increasing, as your placenta is being developed or pieced together. Usually, when you get to your second trimester, that's when your placenta kind of takes over providing nutrients for the baby. And that's when people start to notice their nausea and food aversions improving. So it could just be related to those hormones. It could be related to the fact that all of your organs are being squished around a little bit because you're growing a baby. Um, Key triggers for that nausea that can make it worse: definitely sleep and fatigue, as well as blood sugar drops. So if you are going extended amounts of time without food, like I said, overnight, that's why some people have that nausea first thing in the morning, is because you haven't eaten all night. So your blood sugar gets a little bit low. So making sure that you're eating frequently is something we'll talk about. So with hyperemesis gravidarum, like we said, it's a severe version of morning sickness. And you're going to definitely know if you have this because you won't be able to tolerate anything. You won't have safe foods that we call them. You won't even be able to tolerate water in some circumstances. I have had patients that have had to do um, like IV like hydration and nutrition just to kind of help support them throughout their pregnancy while they worked through that. Not to spook you, but there are options, even if you have severe cases of this nausea and vomiting. So it could lead to some dehydration, electrolyte balance, and weight loss, which we never want in pregnancy. So that's why it's super important that if you are having this, discuss with your doctor, discuss with your dietitian, so that way we can help you make sure that you and your baby are still staying healthy. Um, Tips for avoiding that dehydration: small sips of ice water has been really helpful. Some people notice that if they put lemon in it, it's more helpful. Some people, it doesn't help as much. Ice chips, popsicles, frozen fruit, those things can be really helpful as well. And foods that have high water content, if you're able to tolerate them, like watermelon, cucumber, soups and broths and things like that, can be helpful too. We always recommend doing an electrolyte drink if you are experiencing vomiting, whether it's with hyperemesis or um, if you're just vomiting in general in pregnancy, making sure that you are adding those electrolytes back into your routine is going to be really helpful to make sure that you don't experience any dehydration. So when does it occur? Like we said, first trimester is most common for people, usually starting around 4 to 8 weeks and then going until about 13 to 14 weeks. For me personally, it was about 5 weeks to 15 weeks. I know that some people say like, oh, once you get to your second trimester, it goes away. During your second trimester, it usually improves, but it's usually not immediately at week 12, which is what all of us usually want if we are in this boat. We want to wake up on week 12 and just be cured. And unfortunately, that's not always the case. But like I said, it can extend into later in pregnancy. I have had a couple of patients experiencing nausea and aversions coming back in their third trimester. Not super common, but it is a possibility. It's different for everybody. So just because one person experiences it doesn't mean everybody will. So why this matters. Up to 70% of expectant mothers experience nausea in early pregnancy, which is a lot. Like we said, it's one of the most common pregnancy-related symptoms, and it can make it really hard to function in your daily life. So not only does it play a role in food, nutrition, and hydration, but it can make it a lot harder to go on with other daily activities, work, taking care of yourself. Like I said, brushing my teeth was awful for a little bit. Taking a shower was not something I wanted to do, but did. But if you have other children you have to take care of, cleaning, taking care of your family, all of those things are exponentially harder if you are constantly nauseous or constantly vomiting. In addition to it plays a role into those nutrients that you might be missing. Biggest ones, like we said, protein is going to make or play a big role into that, and that can play into iron and folate and those other B vitamins that are super crucial, especially in early pregnancy. So that's why, another note, that's why dietitians are so helpful throughout pregnancy to make sure we're still getting those because we can find other ways to get those nutrients. And in addition to that, it can feel a little bit isolating because honestly, you do kind of isolate yourself a little bit because you just don't feel great. So, totally understandable if you kind of shell up in your home for a little bit, only doing what is absolutely necessary of you for a couple of weeks. So, how can we manage those symptoms? Lifestyle factors that can be helpful for managing nausea and some vomiting in early pregnancy. Keeping your rooms well ventilated, like I mentioned, certain smells, especially the cooking of certain foods and things like that, can be really, really triggering for some people. So, keeping rooms and things like that well ventilated. Ask others to help you with things like cooking, meal prep, grocery shopping, those kinds of things. If you have someone that can help you, definitely take advantage of that. And if you have the option for any kind of grocery delivery or grocery pickup, that can be helpful, especially if seeing all of the food at the grocery store is a huge trigger for you. I wish I would have done that more often in my pregnancy, but that can be super helpful. It's kind of silly to say, but one thing when I was pregnant, my husband would actually have to cook food in the garage. Like we moved our air fryer into the garage for him to cook food because I just couldn't stand the smell of it. But obviously, he had to still eat. So he had to just cook it somewhere else. So that's always so funny to me. Um, so that can be helpful, having someone else prepare meals, prepare them in a different space if you have the option. And purchasing pre-cooked items, or even if you're having to eat outside of the home a little bit more often, that's okay too. I know for me in my pregnancy, and I've seen with my patients as well, it's a little bit more tolerable if you can just pick up something to go because you don't have to cook, you don't have to clean, and you don't have to really smell the fragrant food cooking and things like that. So if you're able to do any kind of pre-cooked items from the grocery store, or if you have to eat out a little bit more frequently than you're used to, that's okay. Um, where sometimes in early pregnancy, we are surviving, not thriving, and that's okay. Get as much air as possible. Movement can be helpful as much as you don't want to move. I think I left my house like 3 times during my first trimester because I just felt so awful. So I understand if it's not like something you want to do, but getting outside, getting some fresh air can be helpful. And of course, plenty of rest, which if you are super fatigued, you're probably like, yes, I want to rest. But that can be super helpful for the nausea as well. There are some supplements that can help with that nausea as well. So vitamin B6 is a supplement that can help. The recommendation is 10 to 25 milligrams up to 3 times per day. And we listed the upper intake of that of what you don't want to go past in a day is 100 milligrams per day. So even if you were doing 25 milligrams 3 times per day, that can be helpful. One thing to note about this is it is kind of a thing that you have to be very consistent with, starting early and doing it daily, staying on track with that is going to be most helpful. It's not something that's going to help in the moment immediately, like other nausea medications may help with. You can also do ginger capsules or ginger chews. Most of the time you can find it at the grocery store in the candy aisle, little candies that are ginger flavored, and they can be super helpful as well. Of course, always talk to your doctor before you start a supplement. And also you can discuss with your dietitian if you are trying to figure out like how much to take, how frequently, and if you need any kind of recommendation. I know supplements are kind of crazy out there, so if you have questions about that, definitely ask your dietitian. So food remedies for nausea. Like I said, food can be really, really hard. So things like lemon and ginger can be super, super helpful. Some people like to have just fresh ginger that they can add to food. You can do ginger tea, ginger ale, ginger candies can be super helpful. Peppermint tea can be helpful as well. Like we mentioned, hydrating is super, super important. So doing things like broths, watermelon, cucumber are really going to help with hydration, but they also have other nutrients that you're going to get from those as well. Eating every 1 to 2 hours, like I mentioned before, having drops in blood sugar, which is it happens a lot easier in pregnancy than prior to pregnancy. So if you are experiencing, going a couple of hours without food, it's going to make you a little bit more nauseous. I know for me, that was more like every 1 hour, which was not a great time to have to force myself to eat every hour when I didn't want to, but it's what I had to do to just get through. Making sure that you're having enough protein. And like I mentioned, if animal proteins, meat, things like that are really hard for you, discuss with your dietitian some other sources for high protein that can help, maintain that time in between foods to prevent your blood sugar from going up and down and all over the place. Avoid any triggering foods. Some people, greasy foods, spicy foods, things like that can be a little more triggering, but any triggering foods, avoid them if you need to. Other remedies you can try, essential oils. I've known people to do diffusers. You can dab them like on your wrists or on your temples, things like that. Just the scent of them. I know some people that would just tote or carry around the essential oils and just kind of take a whiff whenever they needed to out in public or what have you. I've also seen people do that with alcohol pads, but I don't know that I personally would recommend that. I don't know. That one's kind of a little weird to me. But anyhow. Sipping ice water throughout the day can be helpful. Hard candies or peppermints. I went through a phase where chewing like minty gum was really helpful for me. So that might be helpful for you as well. And then there is an image here of some anti-nausea bands from Freedom Mom. They also make another brand called C bands. I used that. That was particularly helpful for like motion sickness. If we were in the car and we had to go somewhere on a longer drive, they were really helpful for that motion sickness. And they're just little bands. There's like a pressure point on your wrist that they just press and it kind of helps with the nausea. So now we'll get into nutrition a little bit and some easy things that you can try and see if they help for you. So we want to focus on nutrition. It's super, super important, especially in the first trimester, but all throughout pregnancy. Some of those nutrients that are super important, folate, like we've discussed, folic acid, iron, protein, of course, and fluids, and then all of the other B vitamins as well are super, super important. Um, it can be easy even if it's really hard. So we'll share some of those recommendations. And again, this is something your dietitian can be super, super helpful with, giving you new ideas. If you find that something isn't working for you that they have recommended, that's okay. Just let us know. And we want to support you. So if we give you a recommendation and you're like, this is awful, that's okay. We can work through it with you. So one of those things is the brought diet. So bananas, rice, applesauce, toast, and tea. These are all bland foods that are usually a little bit easier to tolerate when you're having a lot of nausea and vomiting, and they're a little bit easier to digest too. For me personally, my brought diet was like a loaf of sourdough bread every single week. I ate so much sourdough bread, it was crazy. And Honey Nut Cheerios. Those were my tolerable foods. So that's what I ate like all the time for weeks. Not my, you know, highest recommendation for pregnancy, but hey, we were getting nutrients and we made it. We were still taking our supplements. So it was all good. Like I said, this can be super helpful because it's bland, easier to digest, easier to tolerate, and you can tell a lot of these foods you don't have to do a lot of prep for, or the prep is super low maintenance and it's not going to be super fragrant and things like that, unless you want to add ingredients like in our image here. So, some other helpful tips, in addition to that, some high protein foods. If you're not able to do animal proteins, meats, things like that, trail mix, Greek yogurt, peanut butter, protein bars, if that's something you can do. Salty things, I know a lot of people tend to crave salty in that first trimester. So crackers, chips, if you have to do that, as long as you're getting something in, that's better than nothing. Something is better than nothing, is what I always tell people. Pretzels, toast, things like that. And can be helpful if you just need snacks super frequently that are quick and easy to grab. Cold foods are usually easier to tolerate, so pasta salads, wraps, sandwiches, things like that, as well as things like smoothies, drinkable options like smoothies, protein shakes. Those can be super helpful. It's going to help you get a little bit more nutrients. If you're doing smoothies, you can also add things like protein powders or collagen powder, something like that, chia seeds to kind of help boost those nutrients. That's something we can definitely discuss with you if that's something that you're interested in. And then we shared a couple of these B6 ingredients that are good for smoothies. So bananas, avocados, spinach, sunflower seeds, all high in B6. So like we said, B6 can be helpful for improving nausea. So those are some things that you can also incorporate if you can tolerate them. So how does this impact weight and what are the concerns there? So weight gain is obviously really, really important for pregnancy. You're going to gain weight kind of no matter what. You're growing a whole baby. Your body is doing a lot of work. So we want to make sure that you're gaining an appropriate amount of weight during your pregnancy. We don't want you to be losing weight. That's a little bit of a red flag for us. So if you are seeing that, definitely let us know. We usually check in with our patients, of course, but if you're starting to notice that, let us know. Um, Maintaining a healthy weight is really important for maintaining a healthy pregnancy, making sure that your baby is, growing appropriately and preventing other complications like gestational diabetes, preeclampsia, and things like that. And like I said, if you're having any weight loss, definitely let us know. So we included this chart for appropriate weight gain or the weight gain during pregnancy. Um, Note that everybody is different. Every pregnancy is going to be different. This is also the recommendation for, a single baby pregnancy, not multiples. So if you are having multiples, it's a little bit different recommendations. And like I said, everybody's a little bit different, and the rate at which you gain the weight is going to be different for everybody. Some people, it's going to fluctuate with a big jump and then a plateau a little bit. Some people, it's more steady. Just kind of depends. So, if you have concerns around your weight, talk to us about that. We can definitely give some recommendations. Um, so the recommendations, depending on your BMI, your pre-pregnancy BMI is what it's based upon, somewhere between 28 to, I would say probably about 15 pounds if I'm going more on averages. So somewhere between that is what you're going to gain. So with that, how do we move forward? It's important to talk to your doctor if you are having any complications such as you're having a really hard time at keeping any foods or fluids down, it might be some hyperemesis that we're seeing. So if you are really, really struggling with keeping anything down at all, you don't have any safe foods, definitely talk to your doctor. If you're losing weight, like we said, if you're checking your weight in between doctor's appointments, I know early in pregnancy, you're only seeing your doctor once a month usually. So if you're noticing, weight changes in between those appointments, definitely discuss with your provider. And if you aren't seeing any improvements at all, sometimes providers can recommend other medications and things like that that can be helpful if needed. So just talk to your doctor if you have additional concerns in addition to what we've discussed today. So with that, we are here with you. We understand nausea is super, super common and we understand how hard it can be. Not usually a huge concern unless you're seeing some issues with intake and nutrient status and weight and things like that. If you are seeing those things, then obviously we have other concerns, but otherwise it's pretty normal to have those symptoms. And while yes, I know like I said, it's a normal thing, but it's also that doesn't make it any easier. So just know that we are definitely understanding of that. It is possible to manage as best you can with food and nutrition. We want to make sure that you are still getting your nutrients. And so make sure you're discussing with your dietitian. If you haven't yet seen one of us, definitely reach out and we would love to chat with you. And your support system is important. So if you need additional support, definitely use it. Pregnancy and postpartum is the time to take all the help you can get. So with that, do we have any questions, concerns, or other comments from anybody?
And feel free to either come off of mute to ask your question, or if you want to drop it in the chat, that works too. But Destiny, I have a question for you. So
Okay.
tell me a little bit more about how we can help patients distinguish between, what is like safe food flexibility, right? I also, use the phrase something is better than nothing,
Mhm.
versus when dietary restrictions due to aversions might become concerning.
Yes, for sure. So I always tell patients if you only have a limited number of safe foods, eat those foods, eat them when you need to, however seem possible. When you get to a point where you feel capable and able to incorporate other things into that to make them a little bit more balanced and more variety of nutrients, definitely do that. So a good example is like we said, the toast is a really good, like bland thing. It's really easy, not a lot of flavor. However, when you get ready to and you feel comfortable to add more nutrients onto that and add some more protein, some healthy fats, we can add some nut butter on that. We can add some avocado if that feels comfortable for you. So, kind of just almost like habit stacking, but maybe nutrient snack stacking maybe is the better word. So just adding in those things. And like we said with the smoothies, I know for me, I started really, really simple with smoothies when I first started them with my nausea, and I was just like Greek yogurt, banana, and strawberry. And like that was as simple as it was. And then just adding, okay, like I think I can do chia seeds because the texture is a little bit different. I think I can add some peanut butter for a little bit more healthy fats. I think I can add, different ingredients to help build that up without it being a heavy lift and without it feeling like you're eating a whole bunch of extra foods that might feel a little bit not great at the time.
I love that. Thank you so much for
For
that.
sure.
Does anyone else have any questions? I don't see any in the chat. Okay, we have a question from Mona. She says, what advice do you have for someone who lives in a multi-generational household and there are cultural components to food? That's a great question, Mona.
Yes, that is a great question. And that's a tricky one because obviously everyone else in your household still has to eat, right? I mean, they still have to eat and they're going to want to eat the foods that are comfortable for them and feel good. So, like I said, if you're able to find what foods are safe for you that are normal foods that you typically eat and are safe or that your family typically consumes, find your safe foods, kind of rely on those a little bit. I think it is okay to discuss with your, family if, hey, this particular thing is really hard for me right now. Is there any way we can compromise on, hey, maybe you cook that meal when I'm outside of the home, or give me a heads up so that way maybe I can go for a walk while you're preparing a meal. Um, I think it's important to have those discussions so other people can help you. They love you, they want to support you as well, and they don't want you to be miserable. So if you are having those experiences, just be sure to communicate with them. And like I said, finding those safe foods that are still, foods that the rest of your family still enjoys, because it is likely you might enjoy family meals all together. Um, then, that can make it a little bit easier because then they know, okay, well, if this is a safe food for you, we'll try to make this a little bit more often, things like that, just discussing that with them to let them know.
Yes, Mona says those are great tips. Thank you, Destiny. Love the idea of a heads up or going for a walk during the prep time. I do as well. Really great advice. Okay, we have another question from Shannon. If someone is leaning on takeout or ordering out at restaurants more, given cooking has been hard with food aversions, what are some ways to choose those quote unquote healthier options when eating
Mhm.
out? Excellent question, Shannon.
Yes, yes, I love that one. So this one's tricky because it's going to be dependent on where you live and what is available to you. If you live in a more rural area, you may not have a lot of variety or a lot of options when it comes to those fast food restaurants or takeout restaurants versus a metro area. You might have more variety, which might make it a little easier to be picky, if you will, with what you're going to pick up. But I would say in general, if we're eating fast food, um, if you're able to tolerate, salads, things like that, go for it. If you're wanting to do veggies, go for it. If that's just not hitting right for you, that's okay. Honestly, I would kind of say just eat whatever you can. I mean, it's not like the best. I mean, you got to choose your words here carefully. I I never want to scare someone away from foods because, like I said, I only ate Honey Nut Cheerios for like weeks. And while that's not something I would do outside of those circumstances, it's not the end of the world. You're still going to get some kind of nutrients. So just in general, I would say find what is working for you, even if it's French fries. And then if, like I mentioned before, if we're able to add something to that to make it a little bit more nutrient dense. Okay, we've done some French fries for a little bit. That's working. Oh, maybe I can try some like a protein source that they have, or oh, they have sliced apples here. Like maybe let me try sliced apples, or oh, they actually have milk. Maybe you don't like milk, maybe you do. Or yogurt parfaits. That's a very common one I see too. But just trying to find other things that you can just try as you feel comfortable. Um, and then knowing that it's going to be okay. It's not the end of the world if you're relying on foods that you wouldn't prior to pregnancy, and it's going to get better. Hopefully, even if it's after your baby is born, it will get better. So it's not a forever situation. It might just be a couple of weeks, a month, 2 months, and usually within that time, you're going to see some improvement too. So don't be hard on yourself. Like we said, something is better than nothing. So yeah, that's my recommendation.
Love that, Destiny. Okay, we have
For
another
sure.
question. Is there anything we can do to decrease our chances of nausea and food aversions through nutrition? Perhaps before the first trimester, so pre-pregnancy stage, or early on? Any key nutrients or vitamins? Those are really
This is a good question. And I wish I would have done more research on this before I got pregnant. But as far as I understand, there's a lot of components to nausea and aversions in pregnancy that are not quite understood. Like we mentioned, hormones can play a big part of that. Part of it could also be related to thyroid conditions. I think that one's a little less researched, but I do think that there is some information that exists out there on the status of like thyroid hormone production and things like that just changing throughout pregnancy. And then it could be genetics as well, which has been true in my family so far. But I think that in general, I would typically recommend if you're planning for pregnancy if you know you're going to get pregnant, definitely go ahead and build up those nutrient stores prior to getting pregnant, just in case you do have this experience of extreme nausea, vomiting, food aversions, that kind of thing. If you know you're planning for a pregnancy, it's best to go ahead, start taking your prenatals, get a wide variety of nutrients in your diet. And that can be helpful even if you do have the nausea, at least you're going to have a little bit of a safety net, if you will, because you are planning for that. In terms of specific supplements and things like that that you can take before, I think a prenatal is going to be your best bet. You might want to take an additional B vitamin supplement because it's going to have all of those extra B vitamins, like we mentioned, that are super important for early pregnancy. Do I promise it's going to prevent you from having nausea and aversions? No, I don't know that anybody can promise that. Otherwise, we would all be doing it, right? Unfortunately, I think it's too misunderstood, or we just don't have a lot of information on it at this point in time. Um, so yeah, that's but as far as I know, unless Cha Cha or Shannon, if you guys know anything different, then please share.
No, I think what you said is spot on. And if you are preparing for a pregnancy, nourishing your body to the best of your ability is really the most ideal way to optimize outcomes across the board. So whether that's avoiding nausea and vomiting, which again is not promised, but just to support a healthy pregnancy overall. Um, okay, someone is asking, do you have any favorite prenatal vitamin brands?
Um, that's a tricky one too, because it depends on where you're able to, what you have access to,
Yeah.
if you're able to find something at your local pharmacy, supermarket, that kind of thing. I would say most important is going to be check out the prenatal for certain nutrients, not necessarily a certain brand or a certain, that kind of thing. We want to look for certain nutrients overall. So we're making sure we've got plenty of iron. We're making sure that we've got plenty of folic acid. We also, I mean, there's a wide variety of nutrients we want to get in our prenatal, but those are like our two biggest. And then if you do have concerns around high risk for gestational diabetes, preeclampsia, there are other supplements that we would want to add as well, but just make sure that you talk to your dietitian about that because then they can give you very specific recommendations on dosage and things like that for those.
Yes, I totally agree. And I do want to mention, I know gummy vitamins have become kind of like a big thing, right? And patients take these gummy prenatals thinking that they have all of the nutrients that you would need during pregnancy. But what most people don't know is a lot of these gummy vitamins, in fact, most of them don't have iron in them. And iron is super, super important to support a healthy pregnancy. So you want to make sure if you are pregnant yourself or if you are a practitioner who is dealing with pregnant patients, you want to make sure you're checking that label to see if it has enough iron or if an additional supplement is needed or if just switching to another supplement altogether might be more helpful.
And I would also add to that, if supplements that are like swallowing a pill is really hard for you, there are powder prenatals that you can purchase. Um, and you can just add it to like a smoothie or something like that. That can be really helpful if swallowing pills is really hard, because I know that that's a very common concern that I have from patients.
Yeah, and there are also liquid supplements that you can rely on as well, because I have definitely had to recommend a few of those for, patients who are kind of having issues with swallowing and things like that. So,
Mhm.
all right. Any other questions? I don't think so. But I just dropped my email address into the chat. So if you do have any questions, take that down. Feel free to shoot me an email. Destiny, this was absolutely wonderful. Thank you so much for providing us with all of this valuable information, all of this great insight. So yeah, thank you guys for joining us, and I hope you all have a great rest of your day. Bye, everyone.